Wow. Dr. Martha Whyte, Regional Director, State Department of Health. Hey, Dr. Martha, welcome back again. Okay,
I know. I feel like we bonded. Do you feel like we bonded?
We have. We need to start paying you as a co-host now, I think.
It's, we got some disinfectant wipes and a couple of T-shirts. If you were listening...
Those are valuable now.
Yeah.
If you were listening to the last segment, I asked this question, and I guess who's better qualified than you? If everybody who's exposed to the virus goes into quarantine, eventually everybody's going to be in quarantine.
No, because not everybody's exposed right now. If those people who are exposed would stay home, and if they know they're exposed, stay away from their family. When we say go home and self-isolate, we don't mean, be, staying in close contact with the people in your home. If you can spread out and have your own little spaces, that's the best option. So if we did that, no, just the people who were currently sick would have it, and it would stop.
Martha.
You wouldn't be exposing anybody else.
Excuse me, not call you Martha. I'm sorry, Doc.
You can.
Yeah, Doc.
My 26-year-old son currently lives with me. He's 2% body fat. He's as healthy as they come. I miss hugging my son. Can we hug each other?
Yes, you can still hug. That's not. Are you hugging him for 30 minutes straight?
No. But I mean, I know where a lot of people are missing that human contact. He lives upstairs. I live downstairs. We don't hang out a lot together. We're not sitting on the couch watching movies together any longer. But I'm like, I know he doesn't get out and see his friends anymore, so he's not having contact with his buddies. And I thought, I just want to give him a hug. Is that okay?
Absolutely. And we don't want people to get themselves in a place where mentally they're feeling so alone and getting down and depressed and sad. What we want people to realize is, yes, you can hug the people that you love. Just realize we want to we don't want to be doing things in close contact for an extended period of time. You can have your meals together. You can, just limit how long you're sitting and talking and visiting with each other. You can sit in a room and watch TV as long as you're distancing yourself from each other. If there's a way to do that in your home, do it. You can go outside. You can go for a walk. My sister was at Betty, Virginia, walking the trails yesterday, and everybody there was keeping probably about 10 feet between each other. So they're aware, but they're out and exercising. So, yes, have that personal contact. We don't want to stop that because that's vital for people.
Yeah.
But we just want to realize how we stay safe while we're doing that.
Excuse me, Aaron's waving frantically down there.
Because you sent me a text yesterday that we didn't get to, and I want to get to it today, regarding young people. Explain your concerns about young people and how they really need to pay attention today.
So I'm very happy to hear that your young and very healthy son is taking this to heart and staying home and not hanging out with his friends. Unfortunately, we have a lot of young people in our community right now who think, it's not going to hurt me. Even if I get sick, I'll be fine. We're going to still have our parties. We're still going to get together. Let me explain what we're seeing in the U.S., which is very different from anywhere else in the country. It is a different behavior of the virus here. We are seeing young, healthy people getting very sick. New York just released some of their data. 55% of their hospitalizations are below 44 years of age and below.
Wow.
Why do you think that is? What's the deal?
Well, they're just speculating right now. But, we know our underlying health in this society is not as good as places where they only eat fresh fruits and vegetables and meat. There's nothing processed. We're not buying boxed food. Yeah, they're not buying boxed foods. They're going to their markets and getting fresh food, and then they walk everywhere. In Europe and in China, their underlying base health is better.
My own theory is...
As a generalization, there's also the concern about vaping in young people and smoking in young people.
My own
to have
theory
them
is, and you
done.
can shoot this down if you want, is that the reason, and I think the numbers may be a little skewed, is simply because if you're 25, you think you're bulletproof. Like you said, I'm 67, I know I'm not. Is it really nothing more than older people are saying, this is kind of serious, and young people aren't?
I think that definitely has something to do with why we're seeing a lot of young people sick. Why they are getting sicker is the question.
Doc, let's address the numbers that we saw yesterday, because a lot of people, we see those numbers from Cato go from 40 to 93 in a day and are freaking out. Explain why the dramatic rise. It all has to do with testing, correct?
Well, yes and no. So yes, we are seeing that we got large batches of tests back at one time. And that jump actually was over a 2-day period, as those tests all have to be entered into systems for them to count, blah, blah, blah. So our numbers were like 61 day before yesterday, and then yesterday went to 94. They're going to go higher. I already have more tests in my office. So we're probably sitting over 100 right now. But we still have those 100 people who are positive. So while I don't want you to think it's doubled in a day or tripled in a day, what I want you to realize is that we still have that many people sick, right?
Mm-hmm. Of the 90 that we're talking about, we got about a minute left.
Oh, less.
Mm-hmm. Of the 90, how many of them are real sick and are in the hospital?
I don't have the exact percentage, but we have a lot of people in the hospital, and we have a lot of people on ventilators. A lot of these were done at outpatient labs, but they are still people that ended up in the hospial.
Dr. Martha
White. So
Whyte.
we're seeing a lot of illness.
Dr. Martha Whyte, I'm sure we'll talk again soon. The check's in the mail, okay?
Thank y'all so much for sharing the information.
You bet.